Our first guest today is Julie Meyer, Director of ThedaCare Behavioral Health. Julie, thanks for being with us.
Of course, thanks for having me.
So in the latest ThedaCare Community Needs Health Assessment, it was identified that mental health needs is the greatest need out of all of our communities that we serve. So what kind of demand are you seeing when it comes to mental health?
Yeah, the demand for mental health and substance use disorder treatment is extravagant. We're doing all we can to keep up with the need. So we're coming up with innovative ways to meet that demand. I will say it's not just about the need, but also in a reduction in stigma that came from all the efforts during COVID to outreach and create awareness around mental health. So it's a good thing as well because it means that people are accessing the care that they need.
Oh, that is important to note there. And over the last couple of years, ThedaCare has really done a lot of different things to help with the demand. What are some of those things that we've done?
Yeah, about 2 years ago, we opened the Behavioral Health Walk-In Clinic in Neenah. This is a really innovative approach to offering same-day services to a variety of behavioral health professionals. So patients can walk in, see a psychiatrist, mental health therapist, or a substance use disorder counselor, receive an evaluation, get started on the right track towards treatment, or just talk to someone when they need to. We've also expanded collaborative care, which is an evidence-based practice where we put a behavioral health practitioner right into primary care. So you can see a behavioral health practitioner when you go for your wellness visit, and that collaboration manager can work with you for months to help you get the access to medication that you might need. We are also opening a brand new clinic in Wapaka, which is going to serve as our Western hub to really enhance access for the Western portion of our footprint.
So we know that mental health is a huge issue for kids and teens. Can you talk about the resources that are available out there for them?
Yeah. ThedaCare has a great partner in Catalpa Health who serves our pediatric and adolescent community in the Fox Valley and beyond. Also, I just want to say starting with your kid's pediatrician is a great way to get connected to Catalpa and other resources in the community. It's never too early to have that first conversation. And if you have any inkling, go ahead and start that conversation.
Yeah, important first steps to take there.
Yes.
So speaking of first steps, we do know that it's kind of difficult to begin those conversations when it comes to mental health needs. So do you have any advice for us how to start those conversations?
Yeah, it's important and it can be scary to have that first conversation, but it's important that we don't sweep it under the rug. So as I mentioned, the pediatrician or those teachers or just a trusted friend is a great place to bring it up. Reference behaviors, ask questions. But again, the longer we wait, the longer it will take for your kid to get the interventions that they need.
And for adults, I think it's maybe even more difficult to have those conversations, especially when you're speaking inward about yourself. What do you recommend to begin that process?
Yeah. Finding someone you trust. Again, we've made such strides as a community to reduce stigma around mental health. I think being vulnerable so that you can start to make strides towards living your best life is so important. So find that person that you trust and start there and know that your best interests will be at heart.
Perfect. Julie, thank you so much for being with us.
Of course. Thank you for having me.